Now from Dolbey, the creator of the #1 rated computer-assisted coding software, comes a solution for clinical documentation improvement called Fusion CDI. Through the combination of artificial intelligence and smart utilities, you can transform your CDI effort into a proactive, 100% efficient process. So you've heard about artificial intelligence, but how does it apply to CDI? Good question. For many, their documentation specialists use tools that result in a predominantly retrospective and reactive review of documentation, often singularly focused on Medicare charts. Fusion CDI now turns that model inside out. The workflow engine inside of Fusion concurrently inspects every encounter for clues and evidence for improvement in the documentation toward more accurate coding, billing, and quality of care. Fusion then flags these charts for review by your staff and prioritizes them based on volume or staff specialties. However, Fusion CDI does more than just guide you in the right direction. It also gives you a reason why. It specifies a clinical indicator without a diagnosis, a likely DRG that is a known RAC target, a 30-day readmit, an HCC code. These are just a few examples out of the thousands of triggers that Fusion CDI uses to help in driving your workflow and chart review. Lastly, Fusion will arm your documentation specialists with smart utilities that make their job easier, faster, and more accurate. Specialists can query the provider, make customized worksheets available at the touch of a button, work with Fusion's pre-coded documentation, and find where the codes are located. Use a full suite of dashboards while analytic reporting tracks the entire process and their success. Interested in learning more about Fusion CDI? Call or click today and see how Dolbey is changing the way healthcare knows documentation improvement.